You searched and NEI's experts answered. Here, NEI faculty answer the web's most searched questions on mental health concerns. I'm Dr. Andy Cutler, Chief Medical Officer of the Neuroscience Education Institute, and with me today is my good friend Dr. Roger McIntyre from Toronto.
Andy, this will be a lot of fun. Looking forward to it.
Me too. So let's get started. So Roger, we're going to be talking about GLP-1 agonists. Roger, what are GLP-1 agonists?
Andy, we're talking about GLP-1 agonists. You and I talk about psychiatry. Are we trespassing where we should be trespassing?
Right.
GLP agonists are better known for helping adults who live with diabetes or obesity or obesity-related morbidity.
That's right.
But we're also learning that GLP-1 agonists, which bind to the GLP-1 receptor, are interesting from a psychiatry perspective because GLP-1 receptors are in the brain.
Glucagon-like peptide. Wait
Yeah.
a minute. These drugs get into the brain?
It's really interesting. These are drugs that mimic naturally occurring glucagon, stimulate the GLP-1 receptor. These receptors are located not just anywhere in the brain, but regions of the brain relevant to thinking and feeling.
Wow.
Which is what is mental illness, problems with thinking and feeling. And what's interesting is that these drugs maybe themselves, maybe indirectly get into the brain. This is still being kind of debated. There's some evidence they do get in the brain in some cases. That's still debated, but still some evidence.
Fascinating.
Yeah.
Well, let's see what people want to know.
Okay, so first question coming in here now is, do GLP-1 receptor agonists help with addiction?
Aha. Well, actually, believe it or not, there are some data on this very issue. There are some data that they can help with cravings and substance abuse issues, right?
Absolutely. In fact, there is a view that one of, not the only, but one of the ways wherein they decrease the ingestion of calorie is by decreasing crave. Nothing wrong with craving.
Yeah.
Look, it's normal, it's adaptive to want a meal when you're hungry.
Mm-hmm.
The question is really, is the craving too intense? Is it too maladaptive? We can't control it.
Yeah.
And that's what they seem to take the edge off. And what's interesting is that there's also some preliminary evidence in animal models that the mouse, the rat, is less likely to consume alcohol excessively if they take a GLP-1.
Wow.
And some people think that this is a common substrate. In other words, the reward circuitry of the brain, of course, relevant to food, relevant to drugs and alcohol, but also relevant to depression.
Wow.
So maybe if there's something wrong with this reward circuit in all the above, maybe we can treat all the above with this type of drug.
Incredible. The synergy, the crossover here is really incredible.
It's pretty cool.
Yeah.
Go on, next one.
Yeah, let's do it.
Okay. Do GLP-1 receptor agonists help with losing weight?
Well, that's an easy one to answer because, as a matter of fact, one of them has been FDA approved for this. A second one just recently got FDA approved. We've had semaglutide, which is actually known as Ozempic for diabetes, but Wegovy for weight loss specifically without diabetes. And then, of course, we have recently had one approved. It's called tirzepatide, and it is known as Mounjaro for diabetes, but just got approved as Zepbound for weight loss.
Zepbound, that's quite a name, but it is actually approved for weight loss. And we all know, because many of us have been around for a little while, Andy, you and I have been, let's just say, maturing over the years.
I like that.
And what at least maturing chronologically, but what I would say is that weight loss comes in different, estimates, if you will. Some is a little bit, some's a lot. I think the really thing that's cool about GLP-1 related weight loss with the medication, it's pretty significant. It's pretty significant, not just on a p-value, but we're talking about 20, 22% of weight loss, not just lasting around for a month or two.
Yeah.
Andy, a year to 18 months out.
Wow.
So we all know losing weight, that's not as hard as keeping the weight off.
Good point.
And they don't just lose the weight, they keep it off for a long time.
Yeah.
And you mentioned the new one, tirzepatide and Zepbound. Sounds like almost like a song or something or a band, but Zepbound. But this one is really cool because it's not just GLP, it's also GIP, the glucose insulinotropic polypeptide, blah, blah, blah. All that really is that 1 + 1 = 2. And in math, but 1 + 1 = 3 in neuroscience. And when you combine those two together, you get even more weight loss.
That's right.
It's pretty cool.
Yeah, there's several mechanisms, right? It's decreasing appetite, slowing down gastric emptying, maybe other mechanisms as well. Incredible.
Good one. Let's move along. Do GLP-1 receptor agonists help with, inflammation? This is pretty cool, Andy.
It is.
And, I think this is really something we're learning more about GLPs. When we look at, for example, molecular or cellular assays in the lab, we know they affect the GLP-1 receptor and all the downstream cascade. What's really cool is they also seem to decrease inflammatory expression in the cell in the body.
Right.
And a lot of folks are conjecturing that may be why it helps the heart, it helps other organs in the body.
That's right.
And there's some really cool data to show that, for example, they might even decrease amyloid, which is a byproduct of inflammatory activation in some cases. So inflammation is kind of like this Union Stations, like where all the trains come in from everything, like a real crossroads of everything, right?
Yeah.
And so it's possible that in addition to their effect on the GLP-1, maybe the anti-inflammatory effects that are being observed, they may have some clinical relevance. It's pretty cool.
Yeah, well, we know decreasing inflammation in the brain can't be a bad thing.
Sure, sure.
You have actually helped me to learn about how inflammation can metastasize to the brain.
Absolutely.
The brain has its own inflammatory machinery and circuitry. And so decreasing inflammation, as you mentioned, that is one of the leading theories of the pathogenesis of Alzheimer's dementia. One of these drugs is actually being studied in a registration quality clinical trial for Alzheimer's dementia.
This is pretty cool. And I think that we're going to be hearing more and more about this in the very near future. Okay, do GLP-1 receptor agonists help with depression?
This is something I think you know a little bit about, Roger.
Well, it's something I've been interested in for a long time. And I can tell you it was all just by chance because I started noticing in the literature that GLP-1 was found in the brain. I thought, that's interesting. And I always thought they were just gut peptides. And they weren't just found anywhere in the brain. They were found in the cognition control area, in the reward area. All the areas, Andy, you and I, when we're dreaming up our target list of things in the brain we want to target with the antidepressant, it was doing all the check boxes. Then we started looking at this in animals. And guess what? The animals were happier. They were less hopeless, and they were even smarter. And now there's some preliminary studies now. We've done some, others have done some, looking at the benefit in their overall well-being and cognition. Little ways to go. I don't want to overstate it. These are sort of, early phase considerations, but we got some leads that this might be antidepressant. That's a thought, not yet proven. And that's not inconsistent with some of the benefits seen in addiction, if you will.
Absolutely. Absolutely. And Roger, you've taught me something else over the years, and that is weight loss by any means is an antidepressant. And if nothing else, these drugs, as we've said, can help with weight loss, and that can't be a bad thing. 100%.
Absolutely. And it's interesting because when you lose weight, you are losing not only weight, but you're also losing some of the inflammation and insulin resistance and the stress axis activation. All that's good. But it's especially good for improving depression and helping antidepressants work.
That's right. I got very interested back in my residency. I did both internal medicine and psychiatry. I was very interested in this crosstalk between the brain and the body. And boy, this really illustrates that beautifully. Roger, in some ways, 1 + 1 is not equaling 2 or 3. It equals 5 here.
It does.
And I think that we in mental health, and certainly those of you who are not healthcare professionals in the audience, we're going to be hearing more and more about this. And I think we need to become more conversant and comfortable with these medicines because of their broad applicability. They're going to be used in other fields of medicine. And the benefits really cut across just some limited specialty areas, such as right now, as we said, they're approved not only for diabetes, but for weight loss, even in patients who don't have diabetes. So stay tuned. We're going to be learning more and more about what they do in the brain.
Been fun to be with you. Fun to be with you, Andy.
Absolutely. This is Dr. Andy Cutler saying thank you for joining us for NEI's Autocomplete.